The Supreme Court overturning Roe v. Wade triggered something unexpected. Doctors who perform vasectomies say they've been inundated by calls from men looking into the procedure. The Fox Medical Team's Beth Galvin explains what's driving this.
It's not clear why, but at Georgia Urology, one doctor says the number of calls coming in from men about vasectomy consults has doubled this summer. And she believes one reason may be the Roe v. Wade decision.
When Brad Slayton first came to see Georgia Urology's Dr. Shaya Taghechian for a vasectomy consult, the 40-something father and his soon-to-be wife had already made up their minds.
I knew, and my wife knew, no more kids.
So Slayton decided to undergo the surgical sterilization procedure, which typically takes about 15 minutes and has an average cost of about $1,000, according to Planned Parenthood.
I have 2 kids from a previous marriage. She has 2 children from a previous marriage, and we were getting ready for our wedding. And it was kind of like, yeah, 4's good, we don't want 5.
And vasectomies seem to be having a moment right now. After a draft of the Supreme Court's Roe v. Wade decision was leaked in May, Google reported a 99% jump in users searching for the term vasectomy and a 250% rise in questions about how effective this procedure is. And Dr. Taghechian says Georgia Urology has seen a similar jump in calls about vasectomies.
I don't think that we expected it to jump this much, but it certainly did. The decision that came down from Roe versus Wade definitely made a huge impact.
After the decision to allow states to restrict abortion, she says vasectomy consults doubled from 15 to about 30 a day.
Probably, I would think it's the husbands or men trying to shoulder some of the burden when it comes to birth control, which I'm sure many women appreciate. And it's a safe, easy, quick procedure, guaranteed to work.
Brad Slayton says he was motivated by his marriage, not the new abortion restrictions, but he says he can see why more men are looking into getting a vasectomy.
If you're not wanting to bring a child into this world, this procedure makes sense for a male to go and do. It's an hour in the door and out the door, it's an hour.
And doctors encourage men to make sure that they are finished having a family before they undergo a vasectomy. The procedure can be reversed, but it's more complicated and it's more expensive. For your Fox Medical Team, I'm Beth Galvin.